Hello and welcome to Learning English Pro. I'm Jer, your online English teacher and guide. Today's lesson is dedicated to a sensitive but crucial topic in nursing, palliative care. Palliative care is all about providing relief from the symptoms and emotional stress of serious illness. It requires not only technical skill, but also compassionate communication with patients and their families. In this lesson, I'll take you through 100 essential English phrases that nurses can use when working in palliative care settings. These phrases will cover everything from explaining the purpose of palliative care to comforting patients in their final days. Also, with this lesson, there's a free PDF guide available for download, which includes all the phrases from this lesson, and I've included an additional vocabulary guide featuring key terms related to terminal illness and palliative care in alphabetical order. You can download this guide for free and the link is in the video description. And at the end of this lesson, I've included a video bundle with additional lessons related to healthcare communication. All the videos are timestamped in the video description for easy navigation, so make sure to check those out. Let's begin this lesson on 100 English phrases for palliative care. Our first section is introducing patients to palliative care. This first set of phrases will give you communication skills to introduce palliative care to patients and their families. These phrases will help explain the purpose of this care and what they can expect. Palliative care is focused on improving your quality of life by managing symptoms and providing emotional support. This phrase keeps the focus on comfort and support to ease any concerns about the term palliative. We are here to ensure that you feel as comfortable as possible. This phrase reassures the patient that the goal is comfort, which is often a top concern. Palliative care can help manage your pain and other symptoms to help you live as well as possible. Here we are emphasizing the positive impact palliative care can have on the quality of life. Our team will work closely with you and your family to create a care plan tailored to your needs. Including the family in care discussions can help everyone feel involved and reassured. Palliative care is not just for end-of-life situations. It's about managing symptoms and providing relief at any stage of illness. Here we can clarify that palliative care is not synonymous with end-of-life care, which is a common misconception. We will focus on what matters most to you and your family. Personalizing care helps the patient feel understood and supported. This type of care focuses on your physical, emotional, and spiritual well-being. With this phrase, we are highlighting the holistic approach that palliative care offers. We are here to help you and your family cope with the emotional challenges of your illness. Here we can emphasize emotional support, as patients and families often need reassurance. Our goal is to reduce pain and improve your overall comfort, so you can focus on spending time with loved ones. Focusing on comfort and quality time can ease patient anxiety. Palliative care is about living as fully as possible, even with a serious illness. This phrase reframes palliative care as something positive and life-affirming. Next, we'll go over phrases you can use to help patients understand and cope with the changes that may come with palliative care. You may notice some changes in your energy levels, but we will help you manage those. Here we are acknowledging changes while offering reassurance. It's normal to feel more tired or weak, and we'll adjust your care plan to help. Here we are explaining that adjustments will be made to ease discomfort. Your appetite may decrease, and we will monitor your nutrition to make sure you're getting what you need. This phrase helps address concerns about eating, and it can reduce stress for both patients and families. We can provide support with daily activities if you're feeling too weak to manage on your own. Offering help with daily tasks can make patients feel less overwhelmed. You might experience some new symptoms, but we'll be here to help manage those as they arise. You can reassure patients with this phrase. It will help them see that they won't face new symptoms alone. We can make adjustments to your medications to keep you as comfortable as possible. Here we can assure patients that their care is flexible and can adapt to their changing needs. It's important to listen to your body and rest when you need to. Here we are encouraging patients to rest, which can help them cope with fatigue. If certain activities become too difficult, we can offer alternatives to make things easier. Here we are providing solutions that help maintain the patient's independence. You might find that certain treatments are no longer necessary. We can discuss the best plan for your care. Here we can help patients understand that treatment goals may change as their illness progresses. We'll focus on the most important treatments to maintain your comfort and quality of life. This phrase can help reassure patients that the care plan will prioritize their comfort. Now let's look at phrases for explaining palliative care to family members. It's important to communicate clearly and compassionately with the patient's loved ones. We'll work closely with you to make sure your loved one is comfortable. This phrase can help reassure families that they are part of the process. Palliative care can help manage pain and other symptoms to improve their quality of life. This phrase emphasizes the benefits of symptom management. We'll be monitoring their condition closely and adjusting care as needed. Here we are explaining that care is ongoing and adaptable. You can reach out to us at any time if you have questions or concerns about their care. Offer open lines of communication, which can help reduce family anxiety. Our goal is to keep them comfortable and ensure they have the best possible quality of life. This phrase reassures families that the focus is on the patient's comfort. We'll discuss any changes in their condition with you immediately. With this phrase, you are keeping families informed to build trust. If there's anything you need during this time, please don't hesitate to ask. It's important to make families feel supported and included. We can provide emotional support to help you cope with the challenges of caring for a loved one. Here we are addressing the emotional toll caregiving can take on families. It's important to take care of yourself as well. We're here to help you through this process. With this phrase, you're encouraging family members to prioritize their well-being too. We will work with you to ensure your loved one's care plan is in line with their wishes. Here we are highlighting the importance of respecting the patient's wishes and family input. Palliative care often involves discussing different treatment options with patients and families. Let's go over phrases you can use to help navigate these conversations. We will focus on treatments that improve your comfort and manage your symptoms. Here we are reassuring the patient that treatments are aimed at making them feel better. Certain treatments may no longer be necessary, but will keep you informed about your options. This phrase helps ease concerns about discontinuing treatments by emphasizing patient choice. We'll discuss any changes to your treatment plan with you and your family. Keep communication open to reduce patient anxiety. Our priority is your comfort, so we'll adjust your medications as needed. This phrase ensures that patients know that their treatment is flexible. We'll focus on pain management and relieving any symptoms you may be experiencing. Here we are emphasizing the importance of addressing pain and symptoms. We'll discuss the benefits and side effects of each treatment option. Provide clear information to help patients make informed decisions. If you experience any discomfort, please let us know so we can make adjustments. Encourage patients to communicate openly about any discomfort, ensuring they feel empowered to request changes. You may choose to stop certain treatments if they no longer improve your quality of life. Reassure patients that it's okay to make decisions based on their comfort. It's important to focus on what makes you feel better day to day, and we'll help guide you through those decisions. Help patients feel supported in making choices about their care. Your care plan will be regularly reviewed and updated based on how you're feeling. Ensure patients that their care is adaptable and regularly assessed. In palliative care, you may encounter difficult situations with patients or family members who are upset, confused, or resistant to care. Here are some phrases to help navigate those challenging conversations. I understand that this is a difficult time, and we're here to support you. Acknowledge the difficulty of the situation and offer emotional support. It's okay to feel frustrated or upset. We're here to listen and help you however we can. Validate the patient's or family's emotions to build trust. We want to work together with you to make sure your loved one is as comfortable as possible. You can use this phrase with family members to emphasize the collaborative nature of the care process. I hear your concerns, and I'll make sure to communicate them with the rest of the care team. Show that the patient's or family's concerns are being taken seriously and will be addressed. Let's take a moment to discuss any questions or worries you have about the care plan. Here we are creating a space for open discussion and addressing confusion. We understand that this is overwhelming, and we're here to walk you through every step. Provide reassurance that they won't be left to navigate the situation alone. It's important that we work together to find the best way to care for your loved one. Encourage collaboration between the care team and the family. We are committed to providing the best care possible, and your input is valuable. Here we are reassuring families that their thoughts are an important part of the process. I understand that this is a stressful time, but we are here to help in any way we can. With this phrase, we are acknowledging the stress and providing emotional support. Let's discuss any changes you'd like to see, and we can explore our options. Offering options helps to de-escalate situations by giving the family some control. Next, we'll cover phrases for the end of life stage, when it's crucial to provide clarity and comfort for both patients and their families. We will do everything we can to ensure that you are comfortable and pain-free. Focus on comfort as the top priority. At this stage, the goal is to manage symptoms and provide emotional and physical comfort. Clarify the shift from curative treatment to comfort care. We will be closely monitoring you to make sure any pain or discomfort is addressed immediately. Reassure patients that they will be cared for attentively. It's okay to talk about any fears or worries you might have. We're here to listen and support you. Encourage open dialogue about end-of-life concerns. We'll focus on the things that matter most to you in these moments. Help patients feel empowered in making decisions about their care. You are not alone. Your care team and family are here to support you. With this phrase, we are reassuring patients that they are surrounded by support. We will help you and your family through every step of this process. With this phrase, we are emphasizing the presence of support for both the patient and their family. Our goal is to make this time as peaceful as possible for you and your loved ones. Reassure patients that their peace and comfort are a priority. We're here to answer any questions you may have about what to expect in the coming days. Offer information to ease anxiety about the unknown. If you feel any discomfort or fear, please let us know immediately so we can help. Encourage patients to speak up about their needs. As patients near the end of life, communication shifts toward offering comfort and ensuring peace. Here are some phrases to help guide those conversations. We're here with you, and we'll do everything to keep you comfortable. Reassure patients that they are not alone in their final days. You are surrounded by people who care deeply about you. Focus on the emotional support available to the patient. It's okay to rest now. We'll take care of everything. Give permission for the patient to let go and rest. We'll be here to support your family through this difficult time. Reassure the patient that their loved ones will be cared for. You've been so strong, and now it's time to rest. Here we are offering comforting words that acknowledge the patient's strength. You are safe here, and we will do everything to ensure you feel peaceful. Reinforce the idea of safety and peace. We're here for you, and we'll stay by your side through everything. Assure the patient of constant support. It's okay to let go if you feel ready. We're here with you. With this phrase, you are offering compassionate permission for the patient to pass when they feel ready. We're here to keep you comfortable and at peace, surrounded by love. Emphasize comfort and the presence of loved ones. We will honor your wishes and keep you at peace. Here we are reinforcing that the patient's wishes will be respected. After a patient passes away, communicating with family members requires great sensitivity. Here are phrases to help with sharing the news of death compassionately. I'm so sorry to inform you that your loved one has passed away peacefully. This is a standard and expected way to inform someone of a loved one's death. It has a gentle tone to soften the blow. Your loved one passed away surrounded by care and love. Here we are offering comfort in knowing that the patient was not alone. We did everything we could, and they were peaceful in their final moments. Reassure families that their loved one did not suffer. Please take all the time you need to process this, and we'll be here to support you. Give families space to process while offering ongoing support. We're here to answer any questions you have during this difficult time. Leave the door open for questions to help families cope. It's important to take your time, and we're here whenever you're ready to talk. Reassure families that there is no rush to process the news. We can offer support and resources to help you and your family through this. Here we can point families toward grief resources for further support. Your loved one was cared for with dignity, and we were with them until the very end. Emphasize that compassionate care was provided to the patient. We understand this is a difficult time, and we're here to help you in any way we can. Offer practical and emotional support for families. Please let us know if there's anything we can do to help you right now. Ensure families feel supported in the immediate aftermath of the patient's death. After a patient passes away, families often need emotional support to process their grief. Let's go over some phrases to offer comfort and practical support during this difficult time. I am so sorry for your loss. We are here to support you however we can. Here we are leading with compassion and acknowledging their grief. Please know that you're not alone. We are here to offer any support you need. Reassuring the families that they have access to help them during this difficult period. It's okay to feel overwhelmed. We can help you with any next steps. Normalize feelings related to grief and offer practical assistance. We have resources available if you'd like to speak with someone about your grief. If possible, you can offer professional support resources such as grief counsellors. Take as much time as you need. We'll be here to help when you're ready. With this phrase, you are giving families permission to grieve at their own pace without feeling rushed. We can help you with the immediate arrangements if you feel ready to discuss them. Offer practical help with post-death arrangements when the family is ready. Your loved one was cared for with respect and dignity at all times. Here you can provide further comfort by reassuring the family that the patient received compassionate care. This is a difficult time, and we are here to provide emotional and practical support. This phrase acknowledges the difficulty of the situation and offers multi-level support. If you'd like, we can arrange a meeting with a chaplain or counsellor for additional support. If possible, you can offer spiritual or emotional support tailored to the family's needs. We'll give you as much time as you need with your loved one before proceeding. Here you can ensure the family feels in control and can take time to say goodbye. Finally, let's look at phrases you can use for follow-up conversations with families and offering grief support in the weeks after a loss. I wanted to check in and see how you're doing. We are here to offer support if you need it. This is a nice way to reach out to families to show continued care and concern. Please don't hesitate to reach out if you need someone to talk to or help with anything. Keep the lines of communication open for families who may need support later. We can provide you with resources for grief counselling and support groups if you're interested. Offering professional help can be a crucial resource for families. If you have any further questions or concerns about your loved one's care, we are happy to answer them. Provide an open door for lingering questions, especially about the patient's final moments. Grief is a personal journey, and there is no right or wrong way to go through it. With this phrase, we are normalizing different grief experiences and give family members permission to grieve in their own way. We understand that this is a difficult time, and we're here to support you as long as you need. If possible, you can offer long-term support, letting families know they aren't forgotten after the initial loss. Would you like us to send over any additional resources on coping with loss? Provide access to grief materials and other support tools when needed. Please know that you are not alone in your grief. We're here to help whenever you're ready. Reinforce that the family has ongoing support available to them. It's okay to reach out whenever you feel ready. We'll be here when you are. Provide comfort by allowing the family to dictate when they're ready for more interaction. Let us know if there's anything we can do to help you and your family during this time. This is a nice way to end a conversation with a broad offer of support to meet their individual needs. And that's the end of our lesson on 100 essential English phrases for nurses in palliative care. Remember, providing comforting, clear communication is key when supporting patients and families in palliative care settings. I hope these phrases help you feel more confident and compassionate when caring for those at the end of life. Don't forget to download the free PDF guide that accompanies this lesson, which includes an additional vocabulary guide with key phrases related to terminal illness and palliative care in alphabetical order. You can find the download link in the description below. Also, don't go anywhere. There is an additional video bundle coming right up. All these lessons are related to the topic of palliative care and general patient care. Today's lesson is 100 English phrases for nurses in emergency situations. In this video, I'll walk you through key phrases you need to communicate effectively in high-pressure medical settings, whether you're triaging patients, stabilizing them, or working with your medical team. Let's get started on our 100 essential phrases for nurses in emergency situations. In an emergency, one of the first things a nurse must do is assess the severity of a patient's condition. These phrases will help you triage patients quickly and efficiently. What is your name and date of birth? You can use this question to establish basic patient information. What seems to be the problem? This is a direct way to ask the patient why they're seeking emergency care. Are you in any pain right now? Where does it hurt? This phrase can be important for identifying areas of pain. On a scale of 1 to 10, how severe is your pain? We say this to assess the intensity of pain, which helps to prioritize treatment. When did the symptoms start? Knowing the timeline is crucial for diagnosing the urgency of the condition. Is this the first time this has happened? This helps understand if it's a recurring issue or a new event. Are you allergic to any medications? Allergies are considered critical information when planning treatment. Are you taking any medications currently? This question helps avoid drug interactions during treatment. Have you experienced this kind of pain before? Identifying patterns can assist with diagnosis. I'm going to take your vital signs. This is basic communication when starting an initial assessment. Once the assessment is complete, stabilizing the patient is the next critical step. Here are key phrases for communicating with the patient and team during stabilization. I'm going to give you some oxygen to help with your breathing. We need to start an IV to administer fluids. We need to start an IV to administer medications. Please stay still while we put on the neck brace. This phrase is useful when dealing with spinal injuries or trauma patients. I'm going to elevate your legs to improve blood flow. You're doing great. Try to take slow, deep breaths. This phrase is great for offering reassurance to a panicked patient. We need to monitor your heart rate closely. I'm going to check your blood pressure now. Let us know if the pain gets worse. This phrase encourages communication about any changes in pain levels. We're going to move you to a more comfortable position. This phrase can help keep the patient calm during movement. Stay with us, you're in good hands. This phrase can offer emotional support during a critical moment. Clear communication with the medical team is essential to providing effective care. Here are phrases that nurses use to communicate with doctors and other healthcare professionals in emergency situations. The patient is experiencing severe chest pain. We need to order an urgent EKG. The patient is hypotensive. Blood pressure is 85/50. We're prepping the patient for intubation. Could you assist with starting the IV? I've administered 2 milligrams of morphine for pain. The patient has a history of asthma. We need to monitor their breathing closely. Can we arrange for a portable X-ray? The patient's oxygen saturation is dropping. Let's get the crash cart ready just in case. In cases of cardiac arrest, fast and clear communication is vital. These phrases are useful for communicating with your team when a patient's heart stops. We have a code blue in room 3. This is the emergency alert for cardiac arrest. Begin CPR immediately. Get the defibrillator. Charging to 200 joules. Clear. Check for a pulse. Administer epinephrine 1 milligram. Continue chest compressions. Switch every 2 minutes. I'm going to secure the airway. Let's check the heart rhythm again. We have a pulse. When a patient is struggling to breathe, nurses need to act quickly and communicate clearly. These phrases will help you manage respiratory distress. I'm going to put you on oxygen to help your breathing. We can say this phrase to offer reassurance to the patient while applying oxygen. Take slow, deep breaths for me. With this phrase, we are coaching the patient to control their breathing. I'm going to check your oxygen levels now. It's important to keep the patient informed. We need to start nebulizer treatment. Let me know if it's harder to breathe. I'm adjusting the oxygen flow rate. We need to prepare for intubation. I'm going to take a blood gas sample. A blood gas sample is used to assess the patient's oxygen and carbon dioxide levels. The patient is cyanotic. We need to act quickly. Cyanotic is the blue discoloration on skin due to lack of oxygen. We're getting you into a comfortable position to help your breathing. You can use this phrase with a patient to let them know you're repositioning them to alleviate distress. Trauma patients require quick thinking and clear instructions. These are key phrases for managing traumatic injuries. Where does it hurt the most? We use this question for identifying the primary site of trauma. We need to stabilize the fracture before moving. I'm applying pressure to the wound to stop bleeding. By using this phrase, you are communicating the wound care steps. We're going to roll you over carefully. With this phrase, you're preparing a patient for movement. We need to immobilize the neck to prevent further injury. This phrase is useful for when you're dealing with a spinal trauma. The patient is losing a lot of blood. Let's start a transfusion. This is something you might say to a colleague to initiate the life-saving treatment. I'm going to apply a tourniquet. A tourniquet can be used in cases of severe bleeding. We need to monitor for signs of shock. Is there any numbness or tingling in your limbs? This question to a patient can help identify nerve damage. We'll be taking you for an X-ray to check for fractures. During emergencies, nurses often need to communicate with family members who are anxious or frightened. It's important to be clear, calm, and compassionate when delivering updates. Your loved one is stable at the moment, and we are closely monitoring their condition. This phrase offers reassurance to family members while giving them an update. We're doing everything we can to help them. With this phrase, you're offering comfort during critical moments. It's a critical situation, but they are receiving the best possible care. This is a balanced way to acknowledge the seriousness of a situation while offering reassurance. We will let you know as soon as there's any change in their condition. This is letting the family know that they'll be informed of updates. I understand this is very difficult, and I'm here to answer any questions you may have. With this phrase, you're providing emotional support and encouraging dialogue. The doctor will speak with you shortly to give you a more detailed update. They are responding well to the treatment so far. With this phrase, you are sharing positive news. We are going to run some tests to better understand their condition. Please wait here and I'll come back with more information as soon as I have it. With this phrase, you're guiding the family on where to stay during the process. I know this is overwhelming, but we are doing everything we can. With this phrase, you're acknowledging the family's emotions while offering reassurance. Administering medications and managing IVs is a critical part of emergency care. It's important for nurses to explain these procedures clearly directly to patients. I'm going to start an IV to give you fluids. I'm going to start an IV to give you medication. This medication should help ease your pain. We're going to give you some antibiotics through the IV. Please keep your arm still while I insert the needle. Let me know if you feel any discomfort. The IV fluids will help stabilize your condition. I'm administering the pain relief now, and it should start working shortly. Can I check your IV site to make sure everything looks good? I'm going to switch your IV to a different medication. You may feel a bit of a sting. Let me know if it becomes painful. Nurses may encounter patients in mental health crisis, requiring them to de-escalate situations and provide calm reassurance. Here are essential phrases to handle these sensitive scenarios. You're safe here. We're here to help you. With this phrase, you're reassuring the patient that they are in a safe environment. Can you tell me how you're feeling right now? In a difficult situation, it's important to open up communication to better understand the patient's mental state. Try to take some deep breaths and focus on calming down. With this sentence, you're guiding the patient through calming techniques. I understand that you're upset, but we need to work together to help you feel better. With this phrase, we're acknowledging the patient's emotions while offering a path forward. We're going to do our best to make you feel comfortable. This phrase is great for offering support and reassurance. Is there anyone you'd like to talk to or contact? It's important to provide the option for the patient to reach out to someone. I'm going to stay with you until things feel more manageable. With this phrase, you're offering your physical presence for reassurance. Would you like to tell me what's been bothering you? With this question, you're encouraging the patient to open up about their feelings. We're here to listen and support you. You're not alone. With this sentence, you're providing emotional support and validation. Let's focus on getting you the help you need. This positive phrase helps by directing the patient's attention towards positive actions. After an emergency situation has stabilized, nurses often need to provide aftercare and discharge instructions to patients. These phrases will help you guide patients through the next steps. You're stable now, but we'll need to keep monitoring you for a little longer. This phrase helps explain the need for continued observation. You'll need to rest and follow these instructions carefully once you're home. This phrase outlines post-discharge care. Please take these medications as prescribed and let us know if you experience any side effects. With this phrase, you're providing medication guidance and support. Here's a follow-up appointment for you to check in with your doctor. It's important to schedule the patient for the next steps in care. Avoid heavy lifting or strenuous activity for the next few days. This is common discharge advice for certain conditions. You can go home once the doctor clears you. With this phrase, you're letting the patient know what to expect before discharge. If you experience any of these symptoms again, come back immediately. This statement provides emergency readmittance instructions. We'll give you a summary of your treatment and instructions to take home. This phrase covers explaining post-care paperwork. Make sure you drink plenty of fluids and get lots of rest. This phrase offers more basic aftercare tips. You're all set. Take care and let us know if you need anything. This phrase can be your final discharge communication with a patient. And that's it for today's lesson on 100 key phrases for nurses in emergency situations. Now it's time for our next lesson. Enjoy. You're very welcome to today's lesson, where we'll be focusing on key phrases and questions doctors use when diagnosing patients. This lesson is designed to help you conduct professional and clear medical consultations in English. For this lesson on patient diagnosis, I'll be taking you through some key English questions and phrases that doctors use when diagnosing their patients. By the end of this lesson, you'll know how to ask the right questions and gather crucial information about your patient's symptoms and medical history in English. Let's get started. It's key to understand the diagnosis process. As a doctor, gathering the right information is critical to making a diagnosis. The questions you should ask should cover several areas. The chief complaint. What is bothering the patient the most? The onset. When the symptoms started. The severity. How serious the symptoms are. And the history. Any previous medical issues or treatments. Now that we've broken down the diagnosis process, let's dive into some key phrases that you can use to ask your patients the right questions. First, you need to understand the patient's main problem. These phrases will help you ask about their chief complaint. What brings you in today? This is a simple way to ask what the patient's main issue is. Can you describe your symptoms? This is a common phrase to get the patient to talk more about their condition. What seems to be the problem? This is another way to ask about the patient's main concern. How long have you had these symptoms? You can say this when you want to understand the timeline of the patient's symptoms. When did you first notice this? This is a great follow-up to pinpoint the onset of the problem. These questions help you get to the heart of the patient's problem, so you can start narrowing down potential diagnoses. Next, it's important to gather more information about when the symptoms began and how long they've lasted. Here are some useful phrases. When did the symptoms start? This is a direct way to ask when the patient first experienced the issue. Did the symptoms come on suddenly, or have they developed over time? This helps determine whether the issue is active or chronic. Has the pain been constant, or does it come and go? Understanding the pattern of the symptoms is essential for diagnosis. Has it gotten worse over time? Useful for tracking the progression of the problem. Are the symptoms better or worse at certain times of the day? This phrase helps identify triggers or patterns. Knowing when and how symptoms began gives you a clearer picture of what might be causing the patient's condition. If the patient is in pain, it's important to assess the severity. These phrases will help you understand how serious the pain or discomfort is. On a scale of 1 to 10, how would you rate your pain? This is a common way to get a numerical assessment of pain levels. Is the pain sharp, dull, or throbbing? This helps to understand the type of pain the patient is experiencing. Does the pain spread or radiate to other parts of your body? This is useful for identifying conditions that affect more than one area. What makes the pain better or worse? This question helps determine if any activities or medications affect the symptoms. Have you taken anything for the pain? Has it helped? It's important to know if the patient has already tried treatments and what the results were. Assessing the severity and type of pain is crucial for diagnosing conditions accurately and recommending the right treatment. Understanding a patient's medical history and lifestyle is also critical to diagnosing their condition. Here are some key questions to ask. Do you have any pre-existing medical conditions? This question helps identifying underlying health issues that could be related to the current symptoms. Are you currently taking any medication? Knowing what medications the patient is on helps avoid drug interactions and can explain certain symptoms. Have you had any recent surgeries or treatments? Past procedures can provide clues to the current issue. Do you smoke or drink alcohol? Lifestyle factors can impact health significantly, and this question helps identify potential risk factors. Has anyone in your family had a similar condition? Family history is important, especially in cases of hereditary conditions. Getting a full picture of the patient's medical history and lifestyle ensures you don't miss any important details in your diagnosis. Once you've gathered all the necessary information, it's time to wrap up the consultation. Here are some phrases to close the conversation professionally. Based on what you've told me, I'd like to run some tests to get a clearer picture. This phrase signals the next step in the diagnostic process. I'm going to refer you to a specialist for further evaluation. If you think the patient needs additional care, this phrase is useful. Let's schedule a follow-up appointment to monitor your condition. It's important to ensure ongoing care by arranging a follow-up. Please let me know if your symptoms change or get worse. This encourages the patient to keep you informed of any developments. Thank you for coming in today. We'll stay in touch with your results. This is a polite and professional way to close the appointment. Ending the consultation in a clear and professional manner helps maintain patient trust and ensures they know the next steps. And that's it for today's lesson on diagnosing patients in English. I hope these key phrases and tips help you feel more confident during your medical consultations. Also, stay tuned because I have a whole series of lessons coming up. The next lesson in the lineup is 50 Essential Phrases for Doctors, covering useful phrases for a variety of medical situations. If you're a doctor working in an English-speaking environment or studying medical English, this video is for you. Today, I'll be covering essential English phrases that doctors use in daily interactions with patients. These phrases will help you build confidence and communicate more effectively in a medical setting. If this is your first time with Learning English Pro, make sure to subscribe to stay updated on all my latest lessons. As a doctor, the first impression you make is crucial. Here are some common phrases doctors use to greet and introduce themselves. Hello, I'm Dr. Smith, and I'll be your doctor today. This phrase sets a professional tone and establishes your role. How are you feeling today? A polite and simple way to check in on the patient's well-being. Please take a seat and let's talk about how I can help you. This phrase invites the patient to sit down and signals you are ready to listen. These simple phrases help put patients at ease and make them feel comfortable talking about their health concerns. Now let's look at some useful phrases for gathering important medical information from your patient. Can you tell me about your symptoms? This is a general question to begin understanding the patient's condition. When did the symptoms start? This phrase will help you determine the timeline of the illness. Have you experienced anything like this before? Checking about past experiences can help identify patterns. Are you currently taking any medication? Asking this question ensures you're aware of any treatments or medicines the patient is using. These questions are essential to creating an accurate diagnosis. Always listen carefully to your patient's responses as they'll guide you to the next steps in treatment. Once you've assessed the patient's condition, the next step is to explain your diagnosis clearly and professionally. Based on your symptoms and test results, it seems like you have the flu. It's best to start by naming the condition in simple terms. This is a common condition that we can manage with the right treatment. This statement will reassure the patient if the condition is treatable. I'd like to order some further tests just to be sure. This explains the need for more tests, keeping the patient informed. Here are some treatment options we can discuss. With this statement, you can introduce treatment possibilities and involve the patient in decision-making. Clarity is key here. Use simple language and avoid overly technical terms unless you're sure the patient understands them. Doctors often need to provide instructions or recommendations. Here's how to phrase them effectively. I'm going to prescribe you some medication to help with your symptoms. This is a straightforward way to inform the patient about medication. Please take this medicine twice a day after meals. This is how we can give specific instructions for how to take a medication. Make sure to follow up with me in a week to see how you're feeling. We would say this to encourage follow-up care and monitoring. You should get plenty of rest and drink lots of fluids. This, of course, is common advice for recovery. These phrases help ensure that your patients know exactly what they need to do to improve their health. It's important to reassure patients and help them feel at ease, especially if they're anxious or unsure about their condition. You're in good hands and we'll do everything we can to help you recover. Saying this offers reassurance and trust. This is a treatable condition and we're going to take good care of you. This statement emphasizes the positive outlook. Don't worry, we'll monitor your progress closely. Saying this ensures the patient knows you'll keep track of their condition. A few kind words can go a long way in helping patients feel more relaxed during their treatment. I hope you enjoyed these essential phrases for doctors working in an English-speaking environment. By using these, you can communicate more clearly with your patients and ensure they understand every step of their treatment. If you find this video helpful, don't forget to like, share, and subscribe for more medical English tips. And stay tuned, coming up is lots more medical-related English vocabulary. Our next topic is doctor types in English. Very, very useful. Hello, you're very welcome to this English vocabulary lesson on doctors. Let's dive right in and have a look at the lesson plan for today's video. So first up, what you need to know is that you'll be learning all about the different types of doctors and their names in English. And of course, this is Learning English Pro, so you'll be learning lots of essential vocabulary relating to each type of doctor. And with this key vocabulary comes essential context. Learn lots of history and important information about the different types of doctors you will learn in this lesson. So it promises to be a really exciting and interesting lesson for you today. So if you're ready, sit back, relax, and let's learn some English on doctors together. Our first type of doctor is a general practitioner. Now this is the British English, general practitioner. It can also be shortened to just GP. GP. Now, this might be more commonly known as a family doctor or your local doctor. In American English, it is commonly referred to as a medical doctor. And this role can also be referred to in American English as a physician. So let's move on and have a look at some additional information and context for a physician or a GP. The area of medicine they work in is known as general medicine. And did you know the earliest documentation for a formal hospital with physicians that treated patients comes from the 5th century BC in Sri Lanka? Hippocrates, who lived from 460 to 377 BC, is commonly called the father of medicine. He is thought to be one of the first physicians to treat disease as being a result of natural rather than supernatural causes. And because of him, we have the Hippocratic Oath, which is an oath of ethics historically taken by physicians. In its original form, it requires a new physician to swear to uphold specific ethical standards. Okay, it's time to move on to our next type of doctor, which is a pediatrician. Repeat after me. Pediatrician. So what does a pediatrician do? A pediatrician is a medical doctor who manages overall health for children from birth until age 18. And the area of medicine is called pediatric medicine. And the very first pediatric hospital was opened in Paris, France in 1802. Let's move on to our next type of doctor, a neurologist. Repeat after me. Neurologist. Neurologists are specialists who treat diseases of the brain and spinal cord, peripheral nerves and muscles. And the field that a neurologist works in is called neurology. Neurologist treats serious conditions like stroke, Alzheimer's disease, and multiple sclerosis. Our next doctor type is a dermatologist. Repeat after me. Dermatologist. And of course, a dermatologist works in the area of dermatology. A dermatologist is a doctor who specializes in conditions involving the skin, hair, and nails. A dermatologist can identify and treat more than 3,000 conditions. These conditions include eczema, psoriasis, and skin cancer, among many others. Next up, we have anesthesiologist. This one's quite tricky. Anesthesiologist. Let's try it one more time. Anesthesiologist. An anesthesiologist works in the area of anesthetics. This provides treatments such as anesthesia, intensive care medicine, critical emergency medicine, and pain medicine. Anesthesia is a state of controlled temporary loss of sensation or awareness that is induced for medical purposes. Our next medical doctor is a dentist. Repeat after me. Dentist. A dentist works in the area of dentistry. A dentist, also known as a dental surgeon, is a surgeon who specializes in dentistry, the diagnosis, prevention and treatment of diseases and conditions of the mouth. Have you ever thought about who the first dentist was? Heze Ra is the earliest dentist whose name is known to us. Around 2600 BC in ancient Egypt, he was known as the chief of dentists. Our next doctor type is an oncologist. Repeat after me. Oncologist. An oncologist works in the area of oncology, but this is more commonly known as cancer treatment. These are doctors who treat cancer and provide medical care for a person diagnosed with cancer. In the area of oncology, there are three major areas: medical, surgical, and radiation. An oncologist treats cancer using chemotherapy or other medications, such as immunotherapy. Let's move on to our next doctor type, a surgeon. Repeat after me. Surgeon. A surgeon works in the area of surgery. And surgery is used to investigate or treat conditions such as disease or injury, to help improve bodily function, appearance, or to repair unwanted ruptured areas. If we look back in history, surgery in different forms has been performed by humans for thousands of years. The earliest evidence comes from over 8,500 years ago. Let's move on to our next doctor, which is a cardiologist. Repeat after me. Cardiologist. A cardiologist works in the area of cardiology, and they are doctors who diagnose, assess, and treat patients with diseases and defects of the heart and blood vessels. Let's take a moment to talk about the human heart. The average heart is the size of a fist in an adult. Your heart will beat about 115,000 times each day. It also pumps about 2,000 gallons of blood every day as well. Our next type of doctor is a radiologist. Repeat after me. Radiologist. A radiologist works in the area of radiology, and they are medical doctors that specialize in diagnosing and treating injuries and diseases using medical imaging procedures. Let's take a look at the types of imaging procedures. There are X-rays, computed tomography, which is also called a CT scan, magnetic resonance imaging, also called an MRI, positron emission tomography, PET, or an ultrasound. Let's move on to our final doctor of this lesson, a psychiatrist. Repeat after me. Psychiatrist. These doctors work in the area called psychiatry. A psychiatrist can diagnose and prescribe medication to treat a variety of complex mental illnesses, such as depression and bipolar disorder. In the area of psychiatry, a founding father of this medical field is Sigmund Freud. He was an Austrian neurologist and the founder of psychoanalysis, a clinical method for treating psychopathology through dialogue between a patient and a psychoanalyst. And with Freud, that brings us to the end of our English lesson on types of doctors. How did it go for you? I hope you really enjoyed it, and thank you for visiting my channel. I really appreciate your support. Hello and welcome to Learning English Pro. Today we'll be going through some essential phrases you'll need when visiting the doctor. Now let's jump right in. I need to make an appointment with the doctor, please. You can use this phrase to request a doctor's appointment politely and efficiently. Try it after me. I need to make an appointment with the doctor, please. Let's move on to our next phrase. I've been feeling unwell lately. This phrase is how you can express your general discomfort to the doctor clearly. I've been feeling unwell lately. I have a sore throat and a cough. With this phrase, you are describing your symptoms accurately to assist in diagnosis. I have a sore throat and a cough. I have a fever. This is what we would say in English if we have a higher than usual body temperature. Repeat after me. I have a fever. I twisted my ankle and it hurts. This is how we might explain to the doctor the cause of your pain and its location. I twisted my ankle and it hurts. I've had a headache for a few days. This is how you convey the duration of your headache for better evaluation. I've had a headache for a few days. I think I might have the flu. With this phrase, you can express your suspicions about your illness, prompting further investigation. I think I might have the flu. Let's move on to our next phrase. I need a prescription for my medication. This is how you request a prescription if it's necessary for your treatment. I need a prescription for my medication. Do I need to take any tests? This is how you might inquire about diagnostic tests that may be required. Do I need to take any tests? Is there a pharmacy nearby? With this phrase, we are asking about the availability of a nearby pharmacy for your prescription. Is there a pharmacy nearby? How much will this medication cost? This is how you inquire about the cost of prescribed medications or treatments. How much will this medication cost? Can you recommend any over-the-counter remedies? When we ask the doctor about over-the-counter remedies, we are asking for recommendations on non-prescription treatments for minor issues. Repeat after me. Can you recommend any over-the-counter remedies? What are the side effects of this medicine? We can use this phrase to learn how to ask about potential side effects of prescribed medications. What are the side effects of this medicine? When should I come back for a follow-up appointment? This phrase is for finding out how to schedule a follow-up appointment to monitor your progress. When should I come back for a follow-up appointment? Thank you for your help, doctor. And with our final phrase, we can express our gratitude to the doctor for their assistance. Thank you for your help, doctor. And there you have it, 15 essential phrases for your doctor's visit. I hope this helps you feel more confident when talking to healthcare professionals. If you have In today's lesson, we're going to explore the essential tools and equipment that every nurse needs to provide the very best in patient care. We'll cover a comprehensive list of 25 crucial items, including the stethoscope, blood pressure monitor, thermometer, and many more. Each tool will be explained with a clear definition and practical sentence example or phrase, helping you understand their importance and how they are used in a hospital setting. Let's get started. Our first piece of equipment is the stethoscope. Repeat after me. Stethoscope. The stethoscope is an instrument used by nurses and doctors to listen to the sounds made by the heart, lungs, and other organs. Let's use this word in a sentence. Let me use my stethoscope to listen to your heart and lungs. Our next piece of equipment is a blood pressure monitor. Blood pressure monitor. This device is used to measure blood pressure, typically consisting of an inflatable cuff and a measuring unit. I need to check your blood pressure with this monitor. Please relax your arm. Next up, we have the thermometer. Repeat after me. Thermometer. This instrument is used for measuring and indicating temperature, commonly used to check a patient's body temperature. I'll take your temperature with this digital thermometer. It will only take a few seconds. Let's move on to pulse oximeter. Pulse oximeter. The pulse oximeter is a non-invasive device that measures the oxygen saturation level of the blood. Let's try it out in a sentence. I'm going to place this pulse oximeter on your finger to check your oxygen levels. Next up, we have glucometer. Glucometer. This device is used to measure the approximate concentration of glucose in the blood. Let's use the glucometer to check your blood sugar levels before your meal. Our next term is commonly mispronounced as syringe. The correct pronunciation is syringe. Repeat after me. Syringe. A syringe is a medical instrument used to inject fluids into or withdraw them from the body. I need to give you an injection, so I'll prepare this syringe. Let's move on to IV drip or intravenous drip. So we have IV drip or intravenous drip. This is a method of delivering fluids, medications, or nutrients directly into a patient's vein. Let's try it out in a sentence. We'll set up an IV drip to make sure you get the fluids you need. Our next term is tricky to say. Catheter. Catheter. Let's try it one more time. Catheter. A catheter is a tube that can be inserted into a body cavity, duct, or vessel to allow for drainage injection of fluids, or access by surgical instruments. Let's check out our sentence example. I'm going to insert a catheter to help you with urination. Next up, we have bandages. Bandages. Bandages are strips of material used to bind a wound or to protect an injured part of the body. After cleaning the wound, I'll apply these bandages to protect it from infection. Let's move on to defibrillator. Defibrillator. This life-saving device is one that delivers a dose of electric current or shock to the heart to restore a normal heartbeat. Let's check out our sentence example. In case of an emergency, the defibrillator is used to restart the heart. Scalpel. Repeat after me. Scalpel. A scalpel is a small and sharp knife used in surgeries and medical procedures. Please hand me the scalpel for the incision. Next up, we have gloves. Repeat after me. Gloves. Gloves are a protective covering for the hands worn by medical professionals to prevent contamination and spread of infection. I always wear gloves to maintain hygiene while treating wounds. Our next piece of equipment is a face mask. Face mask. This is a protective mask covering the nose and mouth, or nose, mouth and eyes, worn to reduce the spread of infectious agents. Please wear this face mask to protect yourself and others. Gown. Gown. A nurse's gown is a protective garment worn by medical staff during surgical procedures or patient care to maintain hygiene. Let's try it in a sentence example. I'll put on a sterile gown before assisting in the surgery. Let's move on to tuning fork. Tuning fork. A tuning fork is a tool that provides a fixed tone when struck. This is used to test hearing or vibration sense. I'm using this tuning fork to check your hearing. Our next piece of equipment is the otoscope. Otoscope. An otoscope is a device used to look into the ears to examine the ear canal and eardrum. I'll use the otoscope to check for any signs of ear infection. A similar tool is the pen light. Pen light. This device is a small flashlight used to examine patients, especially to check pupil responses. Let's try it in a sentence. I'll use this pen light to check your pupils for any abnormalities. Next up, we have walker. Walker. A walker is a framework used for support when walking, typically for elderly or injured patients. Use the walker to help you move around safely after your surgery. Wheelchair. Wheelchair. A wheelchair is a chair fitted with wheels, used by people who cannot walk or who have difficulty walking. Let's take a look at our sentence example. I'll take you to your room in a wheelchair for your comfort. Next up, we have crutches. Crutches. Crutches are mobility aids that help a person walk when they have an injury or disability affecting the legs or feet. I'll teach you how to use the crutches to move around safely. Our next piece of equipment is the sterilizer. Sterilizer. The sterilizer is a device used to sterilize medical instruments to ensure they are free of all microorganisms. Let's try it in a sentence. All surgical tools must go through the sterilizer before being used. Our next term is medical chart. Medical chart. A medical chart is a comprehensive record of a patient's medical history and treatment. Make sure to update the patient's medical chart with today's observations. Let's move on to suction machine. Suction machine. A suction machine is a device used to remove bodily fluids from a patient's airway or surgical site. During the procedure, we used a suction machine to clear the airway. Our next piece of equipment is called an ECG machine or electrocardiogram. So ECG machine or electrocardiogram. This device is used to measure the electrical activity of the heart. Let's try it in a sentence. We'll use the ECG machine to monitor your heart's activity. Our final piece of equipment for this part of our lesson is the nebulizer. Nebulizer. This is a device that administers medication in the form of a mist inhaled into the lungs. Let's take a look at our final sentence. I'll set up the nebulizer to help you with your breathing treatment. Well done, you've done a great job of learning 25 terms for essential nursing tools and equipment. Let's move on to our next lesson, which is 100 phrases for nurses. These phrases are essential for daily interactions with patients, doctors, and other healthcare professionals. So whether you're a beginner or have some experience, this lesson is designed to enhance your communication skills in a medical setting. So let's get started. Grab your notebooks and let's dive into today's lesson. Remember, practice makes perfect, and I'm here to support you every step of the way. And our first topic is patient admission. Welcome to our facility. How are you feeling today? Welcome to our facility. How are you feeling today? Can you please fill out this form? Can you please fill out this form? Do you have any allergies? Do you have any allergies? What brings you here today? What brings you here today? Can you describe your symptoms? Can you describe your symptoms? Do you have any existing medical conditions? Do you have any existing medical conditions? Are you currently taking any medications? Are you currently taking any medications? Have you been hospitalized before? Have you been hospitalized before? We need to take your vital signs. We need to take your vital signs. Please provide a sample of your urine. Please provide a sample of your urine. Well done, that's 10 phrases learnt already for the world of nursing. Next up, let's take a look at some phrases relating to taking a patient's vital signs. I need to take your blood pressure. I need to take your blood pressure. Please roll up your sleeve. Please roll up your sleeve. I'm going to check your temperature. I'm going to check your temperature. Let me measure your pulse. Let me measure your pulse. I need to listen to your heart and lungs. I need to listen to your heart and lungs. Please breathe in and out slowly. Please breathe in and out slowly. Your vital signs are normal. Your vital signs are normal. Your blood pressure is a bit high. Your blood pressure is a bit high. Your temperature is elevated. Your temperature is elevated. I need to record your oxygen levels. I need to record your oxygen levels. Now it's time to move on to our third topic, which is medication administration. It's time for your medication. It's time for your medication. Have you taken this medication before? Have you taken this medication before? Please take this pill with water. Please take this pill with water. Do you have any difficulty swallowing pills? Do you have any difficulty swallowing pills? This injection might sting a bit. This injection might sting a bit. I'll need to give you an IV. I'll need to give you an IV. Are you experiencing any side effects? Are you experiencing any side effects? This medication should help with your pain. This medication should help with your pain. Make sure to take this with food. Make sure to take this with food. Let me know if you feel any discomfort. Let me know if you feel any discomfort. It's time to move on to our next topic, which is patient care. How are you feeling today? How are you feeling today? Do you need help with anything? Do you need help with anything? Are you in any pain? Are you in any pain? Can you rate your pain on a scale from 1 to 10? Can you rate your pain on a scale from 1 to 10? Let me help you sit up. Let me help you sit up. I will assist you to the bathroom. I will assist you to the bathroom. Do you need help changing your clothes? Do you need help changing your clothes? Let me adjust your pillow. Let me adjust your pillow. Would you like a blanket? Would you like a blanket? Can I get you anything to drink? Can I get you anything to drink? We are already on our 5th topic, wound care. I need to change your dressing. I need to change your dressing. This might hurt a little. This might hurt a little. I'm going to clean the wound now. I'm going to clean the wound now. We need to keep this area dry. We need to keep this area dry. Please try not to touch the wound. Please try not to touch the wound. The wound is healing nicely. The wound is healing nicely. I'm going to apply some antibiotic ointment. I'm going to apply some antibiotic ointment. You may feel a bit of pressure. You may feel a bit of pressure. I will bandage this up for you. I will bandage this up for you. Let me know if it starts bleeding again. Let me know if it starts bleeding again. We are halfway through our English lesson on phrases for nurses. Next up, our topic is patient education. It's important to take your medications as prescribed. It's important to take your medications as prescribed. You need to follow a low-sodium diet. You need to follow a low-sodium diet. Regular exercise is beneficial for your health. Regular exercise is beneficial for your health. Make sure to stay hydrated. Make sure to stay hydrated. Here's how to manage your condition at home. Here's how to manage your condition at home. Always wash your hands before eating. Always wash your hands before eating. Avoid smoking and excessive alcohol consumption. Avoid smoking and excessive alcohol consumption. Monitor your blood sugar levels regularly. Monitor your blood sugar levels regularly. This pamphlet contains useful information. This pamphlet contains useful information. If you have any questions, don't hesitate to ask. If you have any questions, don't hesitate to ask. Our seventh topic is communication with doctors. I need to update the doctor on your condition. I need to update the doctor on your condition. The doctor will be in to see you shortly. The doctor will be in to see you shortly. Let me check with the doctor about that. Let me check with the doctor about that. The doctor has prescribed a new medication for you. The doctor has prescribed a new medication for you. I need to report this symptom to the doctor. I need to report this symptom to the doctor. The doctor has ordered some tests. The doctor has ordered some tests. I will consult with the doctor about your treatment. I will consult with the doctor about your treatment. The doctor has requested a follow-up appointment. The doctor has requested a follow-up appointment. I'll inform the doctor about your pain. I'll inform the doctor about your pain. The doctor will review your test results. The doctor will review your test results. In our next topic, we will take a look at phrases you can use in an emergency situation. We need to act quickly. We need to act quickly. Stay calm, we are here to help. Stay calm, we are here to help. Call for emergency assistance. Call for emergency assistance. I need to check your vital signs immediately. I need to check your vital signs immediately. Please follow my instructions. Please follow my instructions. Are you experiencing chest pain? Are you experiencing chest pain? We need to start CPR. We need to start CPR. The defibrillator is on its way. The defibrillator is on its way. I need to stabilize you before the doctor arrives. I need to stabilize you before the doctor arrives. You are in good hands. You are in good hands. Let's move on to our penultimate topic, discharge instructions. You are ready to be discharged. You are ready to be discharged. Here are your discharge papers. Here are your discharge papers. Make sure to follow up with your primary care physician. Make sure to follow up with your primary care physician. These are your home care instructions. These are your home care instructions. Take your medication as directed. Take your medication as directed. Schedule a follow-up appointment. Schedule a follow-up appointment. If you experience any complications, contact us immediately. If you experience any complications, contact us immediately. Keep the wound clean and dry. Keep the wound clean and dry. Avoid strenuous activities. Avoid strenuous activities. Thank you for choosing our facility. Thank you for choosing our facility. It's time to move on to our final topic for this lesson, general courtesy. How can I assist you today? How can I assist you today? Please let me know if you need anything. Please let me know if you need anything. I'm here to help you. I'm here to help you. Your comfort is our priority. Your comfort is our priority. Thank you for your patience. Thank you for your patience. I appreciate your cooperation. I appreciate your cooperation. We aim to provide the best care possible. We aim to provide the best care possible. Feel free to ask any questions. Feel free to ask any questions. I will be with you shortly. I will be with you shortly. Have a great day. Have a great day. Well done, you've learned 100 new phrases. These phrases should help nurses in their daily interactions and ensure clear, effective communication with patients, doctors, and other healthcare staff. And don't go anywhere because our next lesson is coming right up, nurse types in English. Today we're delving into a captivating topic that bridges languages and cultures, nursing roles. Okay, let's get right to it. Our first role is a registered nurse, or abbreviated to RN in the United States, or a registered general nurse in the UK, an RGN. This type of nurse provides direct patient care, administers medications, monitors patients' conditions, and collaborates with doctors to plan and implement treatment. Next up, we have a licensed practical nurse, an LPN, in US English. In UK English, it's called an enrolled nurse, or an EN. This type of nurse assists with patient care, performs basic medical tasks, and monitors patients' vital signs under the supervision of RNs or doctors. A certified nursing assistant, a CNA in US English, or a nursing auxiliary in UK English, provides hands-on care to patients, assisting with activities of daily living such as bathing, feeding, and dressing. A clinical nurse specialist in American English, or advanced nurse practitioner in UK English. These are advanced practice nurses who specialize in a specific care, like pediatrics or critical care, and they provide expertise in patient care, education, and research. In American English, our next role is referred to as a nurse practitioner. In British English, it's called a nurse prescriber. These are advanced practice nurses who can diagnose and treat medical conditions, order tests, and prescribe medications, often working independently. A certified registered nurse anaesthetist in American English, or simply a nurse anaesthetist in UK English, administer anesthesia to patients who are undergoing surgery, ensuring their comfort and safety during procedures. A certified nurse midwife in the US is simply called a midwife in UK English. They provide care to pregnant women before, during, and after childbirth, offering a holistic approach to maternity care. A pediatric nurse in American English is called a children's nurse in UK English. These nurses specialize in caring for infants, children, and adolescents, addressing their unique medical and emotional needs. A neonatal nurse is a term used in both US and UK English. These refer to nurses who care for newborns, particularly those born prematurely or with medical complications. And this is usually done in neonatal intensive care units. An oncology nurse in the US may be called a cancer nurse in the UK. These types of nurses specialize in caring for patients with cancer, providing support, administering treatments, and managing side effects. An emergency room nurse is a general term, and this relates to nurses who work in the fast-paced environment of the emergency room. Their work involves assessing and treating patients with various medical emergencies. Our next term is intensive care unit nurse. Intensive care unit is usually abbreviated to ICU, so this nurse is typically called an ICU nurse. And they care for critically ill patients, monitoring their conditions and administering specialized treatments in intensive care settings. Let's move on to the operating room nurse. These nurses assist surgeons during surgical procedures, ensuring that the operating room environment is sterile and safe. A psychiatric nurse specializes in mental health care, providing support, therapy, and medications to patients with psychiatric disorders. Let's move on to geriatric nurse. Geriatric nurses care for elderly patients, addressing their unique health needs and promoting quality of life in aging populations. A rehabilitation nurse works with patients recovering from injuries or surgeries, helping them regain mobility and their independence. Our next nurse role is the community health nurse. Community health nurses provide care and education to individuals and families within communities, focusing on preventative care and health promotion. School nurses care for students' health and well-being, managing medical needs and promoting a healthy school environment. A hospice nurse or a palliative care nurse provide compassionate care to those who are terminally ill and their families, focusing on comfort and quality of life. And last but not least is the travel nurse. Travel nurses work on short-term assignments in various healthcare settings, often moving between hospitals or regions to address staffing needs. Today we're focusing on medical vocabulary essential for the Occupational English Test or OET exam. Whether you're a nurse, doctor or other healthcare professional, having a strong grasp on these terms will help you communicate effectively and succeed in your test. Now let's get back to our lesson on essential vocabulary for the Occupational English Test. In this lesson, you will learn the pronunciation and definition for each word or term. Then we will put our English conversational skills to the test with an English phrase and learning additional information about the term along with keywords to use with it. Let's get started. Is prognosis. Prognosis. A prognosis is the likely course of a disease or ailment. The prognosis for recovery is good with early treatment. A prognosis may include expected recovery time, potential complications, and overall chances of recovery. It's based on statistical data, clinical experience, and individual patient factors. Etiology. Repeat after me. Etiology. The definition of etiology is the cause or origin of a disease. Let's take a look at our conversation phrase example. The etiology of the patient's symptoms was determined to be bacterial. Understanding etiology is crucial for effective treatment. Diseases can have multiple etiologies, including genetic, infectious, environmental, and lifestyle factors. Up next, we have acute. Repeat after me. Acute. If a symptom is described as acute, it is a condition with a rapid onset and a short course. She was admitted to the hospital with acute appendicitis. Acute conditions often require immediate medical attention. Examples include acute myocardial infarction, acute bronchitis, and acute pancreatitis. Chronic. Chronic. In a medical context, if something is chronic, it is a long-developing syndrome or condition. Chronic asthma can be managed with proper medication. Chronic conditions persist over a long period, often for life. They can be managed but usually not cured. Examples include diabetes, chronic obstructive pulmonary disease, and hypertension. Our next term is remission. Repeat after me. Remission. Remission is defined as a period during which symptoms of a disease are reduced or disappear. Let's take a look at our example phrase. The patient's cancer is in remission following chemotherapy. Remission can be partial or complete. During complete remission, no signs of the disease are detectable, but it does not necessarily mean the disease is cured. Exacerbation. Exacerbation. This term means a worsening or flare-up of symptoms. The patient experienced an exacerbation of their asthma due to the cold weather. Exacerbations often require adjustments in treatment. Triggers can include infections, allergens, and changes in weather or medication. Let's move on to palliative care. Repeat after me. Palliative care. This is specialized medical care focused on providing relief from the symptoms and stress of a serious illness. Palliative care improved the quality of life for the patient with terminal cancer. Palliative care aims to improve quality of life for both the patient and the family. It can be provided alongside curative treatment. Our next term is idiopathic. Idiopathic. Idiopathic means pertaining to a disease with no known cause. The patient was diagnosed with idiopathic pulmonary fibrosis. Idiopathic conditions often require extensive investigation to rule out known causes. Let's move on to nosocomial. Nosocomial. Nosocomial refers to infections acquired in a hospital setting. Let's check out our example phrase. The patient developed a nosocomial infection after surgery. Nosocomial infections can be prevented through strict hygiene and infection control practices. Let's move on to iatrogenic. Iatrogenic. This refers to a condition which results from the activity of healthcare professionals or medical treatment. The rash was an iatrogenic effect of the medication. Iatrogenic conditions can result from medications, surgeries, or other treatments. Prophylaxis. Prophylaxis. Prophylaxis describes measures taken to prevent disease. Our example phrase is, prophylaxis with antibiotics can prevent infections after surgery. Prophylactic measures include vaccinations, medications, and lifestyle changes. Let's move on to pathognomonic. Repeat after me. Pathognomonic. This describes something which is specifically characteristic or indicative of a particular disease. Let's take a look at our example phrase. Koplik spots are pathognomonic of measles. Pathognomonic signs help in the definitive diagnosis of diseases. Let's move on to comorbidity. Repeat after me. Comorbidity. This describes the presence of one or more additional conditions co-occurring with a primary condition. Let's use it in an example phrase. The patient has diabetes with comorbid hypertension. Managing comorbidities is crucial for comprehensive patient care. Histopathology. Repeat after me. Histopathology. Histopathology is the microscopic examination of tissue in order to study the manifestations of disease. The histopathology report confirmed the presence of malignancy. Histopathology is essential for diagnosing various cancers and other diseases. Let's move on to auscultation. Auscultation. Auscultation is listening to the internal sounds of the body, typically with a stethoscope. Auscultation revealed wheezing in both lungs. Common areas for auscultation include the heart, lungs, and abdomen. Next up, we have palpation. Palpation. This is the technique of examining parts of the body by touch. The doctor used palpation to detect abnormalities in the abdomen. Palpation helps in assessing organ size, shape, and tenderness. Cyanosis. Cyanosis. Cyanosis is a bluish discoloration of the skin due to poor circulation or inadequate oxygenation. Cyanosis was observed in the patient's lips and fingertips. Cyanosis can indicate respiratory or cardiovascular problems. Our next term is dyspnea. Repeat after me. Dyspnea. This term describes difficult or laboured breathing. The patient reported experiencing dyspnea upon exertion. Dyspnea can be a symptom of various respiratory and cardiac conditions. Our next term is edema. Repeat after me. Edema. This describes swelling caused by excess fluid trapped in the body's tissues. Let's check out our example phrase. The patient had pitting edema in the lower extremities. Edema can result from heart failure, kidney disease, or liver disease. Let's move on to hypoglycemia. Hypoglycemia. Hypoglycemia is an abnormally high blood glucose level. The patient was admitted with hypoglycemia due to uncontrolled diabetes. Symptoms of hypoglycemia include frequent urination, increased thirst, and blurred vision. Hypertension. Repeat after me. Hypertension. Hypertension describes high blood pressure. Our example phrase is, lifestyle changes can help manage hypertension effectively. Hypertension is a major risk factor for cardiovascular diseases. We also have the term hypotension. Hypotension. Hypotension indicates low blood pressure. The patient experienced dizziness due to hypotension. Hypotension can cause symptoms like dizziness, fainting, and shock. Tachycardia. Tachycardia. This term describes an abnormally rapid heart rate. The patient's tachycardia was managed with medication. Tachycardia can be caused by stress, anxiety, fever, or heart conditions. Let's move on to bradycardia. Bradycardia. This describes an abnormally slow heart rate. The athlete's bradycardia was considered normal due to their high fitness level. Bradycardia can be normal in well-trained athletes, but may indicate a problem in others.